In fact, most of the progress that we're making in terms of treating dementia is related to Alzheimer's disease. And these new diagnostic techniques are going to be very helpful for a couple of reasons when it comes to treatment. The first is that if you have this abnormal pathology in the brain, and you have a medication that may lower that pathology or change that pathology, we now have a measure that we can look at, a quantitative measure that we give treatment X, and if that protein goes down, it is very likely that that's going to be an effective treatment for the Alzheimer's type dementia. Along with other scientific advances to a number of different ways to attack the problem of Alzheimer's disease, either through lowering the production of the abnormal amyloid protein, or by actually removing it from the brain using immuno treatments. The new kid on the block is this tau imaging, and it also coincides with new understanding of how this abnormal, what we call hyperphosphorylation of tau, that leads to the neurofibrillary tangle that actually is the principal neuron injury that leads to the symptoms. We're learning more about how that abnormal protein disseminates through the brain, and that may open up some new and exciting ways to treat Alzheimer's disease even when it's already at a dementia stage. So we have this kind of confluence of advancing science to understanding the basic pathological mechanisms, as well as advancing science that helps us to do the diagnostic and monitoring to combine to making much more effective clinical trials and possibly new medications. Certainly, yes. So there are, best way to say it, breaks up into two large categories, okay? There are genetic risks, some of which are what we call deterministic, so mutations, okay, or chromosomal abnormalities. If you are the unfortunate rare person to have those, then you will get a dementia syndrome. That's about 1% of all the dementias attributable to Alzheimer's disease. If Down syndrome is one of the high-risk ones, but then there are three classes of mutations in the amyloid precursor protein, presenilin 1 and presenilin 2. But again, all of those taken together is a very small number, okay? The second genetic effect is what we call a genetic risk factor, and the number one genetic risk factor is what we call a polymorphism in the apolipoprotein E. So this protein is coded by two genes, one on each allele, or one on each, comes from your father and your mother, okay? And that combines to having a bunch of different combinations. The important point is that if you have the apolipoprotein E4, either as one copy from either your father or your mother, or two copies, one from each, that substantially increases your lifetime risk. It is not deterministic, though. You can have these and not get Alzheimer's disease.